NZS 8134-2021, Ngā Paerewa Health and Disability Services Standard, Public and Private Overnight Hospital and Patient Services. Please join us for the Manatū Haura Ministry of Health karakia. Fire, 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 ngā uratanga o te Manatū Haura. Ko te manakitanga, ko te kaitiakitanga, ko te whakapono, ko te kokiri ngā tahi, kia te ato tātou, ki pai tata, ki pai tawhiri, ki pai ora. Kia tuturu ka whakamoa, kia tina tina. Homae, huie, tākie. He waka iki noa, a canoe which we are all in with no exception. No mai, haere mai. Welcome to NZS 8134-2021 Ngā Paerewa Health and Disability Services Standard, Public and Private Overnight Hospital Inpatient Services presentation. A decision was made to pre-record these presentations based on previous feedback from live online sessions. Please use the certification at health.govt.nz email for any direct queries about this presentation or the standard. The purpose of this presentation is to give public and private overnight hospital inpatient service providers an overview of Ngā Paerewa. This includes a summary of the standards mapping and how the transition to the new and partially new standards will be initially audited. There are also links to resources and templates for your reference. The Health and Disability Services Safety Act 2001 requires regular review of the Health and Disability Services Standards and Fertility Services Standard. Reviewing these standards regularly is important to ensure that they reflect the services being provided today and continue to work for health practitioners, service providers, and those using the services in their whānau. In 2017, the Ministry of Health began a significant review and consultation process with the health and disability sector, including health practitioners, service providers, advocacy and support groups, iwi, and the people in whānau who use our health and disability services. The review provided the health and disability sector with the chance to ensure the standards are flexible enough to reflect current accepted best practice and also incorporate changing ways of delivering high quality care and support. For more information about the review process, please visit the Ministry website. Other standards included in the review were the home and community support sector, as they had some crossover into their services. For this reason, the Home and Community Support Sector Standard, NZS 8158-2012, was considered as part of this review with the support of the sector. Following the passing of the Abortion Legislation Act 2020, the role of regulating abortion services transferred to the Ministry. Its interim standards for abortion services in New Zealand were also included in the review. Following agreement from the sector, the 2021 standard combined the following 4 standards into one, which significantly reduces duplication and variation across the services. Health and Disability Services Standard NZS 8134-2008, Fertility Services Standard NZS 8181-2007, Home and Community Support Sector Standard NZS 8158-2012, and the interim standards for abortion services in New Zealand. The 2021 standard applies to over 650 different providers, including fertility services, primary birthing centres, hospices, overnight hospital inpatient services, both public and private, age-related residential care services, residential mental health and addiction services, and disability services. The standard is also fit for use by home and community support services and abortion service providers in Aotearoa, New Zealand. The Standards Approval Board approved the 2021 standard on the 4th of May 2021. The Minister of Health approved the 2021 standard for use under the Act on the 24th of June 2021. The 2021 standard will become mandatory on the 28th of February 2022. A PDF of the standard is available to download from Standards New Zealand website. The Ministry has funded the ability for the sector to download the PDF without cost. A hard copy can be ordered from the Standards New Zealand website for a fee of $68. It is intended that the standard will remain dynamic, reflecting current accepted practice. Regular reviews will be undertaken to ensure that this is achieved and that the standard remains appropriate and applicable. The standard represents the minimum requirements necessary for a fair and equitable health and disability service that aim to improve the experience and outcomes of people and whānau and reduce care variation. The revised standard reflects the fundamental shift towards more person and whānau-centred health and disability services. People are empowered to make decisions about their own care and support in order to achieve their goals, and there is a stronger focus on outcomes for people receiving support care. The standard has been arranged into 6 sections. The 6 sections of the standard are Section 1, Our Rights, Section 2, Workforce and Structure, Section 3, Pathways to Wellbeing, Section 4, Person-Centred and Safe Environment, Section 5, Infection Prevention and Antimicrobial Stewardship, Section 6, Restraint and Seclusion. Sector guidance, aligned with the 6 sections of the standard, can be found online on the Ministry of Health website. The health and disability system is committed to fulfilling the special relationship between Māori and the Crown under Te Tiriti o Waitangi. Ensuring that the standard supports health and disability service providers to honour Te Tiriti was a key aim of the most recent iteration of NZS 8134. The principles of Te Tiriti, as articulated by the courts and the Waitangi Tribunal, provide the framework for how we will meet our obligations under Te Tiriti in our day-to-day work. The 2019 Haora report recommends the following principles for the primary healthcare system. These principles are applicable to the wider health and disability system. The 5 principles that apply to our work are Tino Rangatiatanga, the guarantee of Tino Rangatiatanga, which provides for Māori self-determination and mana motuhake in the design, delivery and monitoring of the health and disability services. Equity, the principle of equity, which requires the Crown to commit to achieving equitable health outcomes for Māori. Active protection, the principle of active protection, which requires the Crown to act to the fullest extent practicable to achieve equitable health and outcomes for Māori. This includes ensuring that its agents and its treaty partner are well informed on the extent and nature of both Māori health outcomes and efforts to achieve Māori health equity. Options, the principle of options, which requires the Crown to provide for and properly resource kaupapa Māori health and disability services. Furthermore, the Crown is obliged to ensure that all health and disability services are provided in a culturally appropriate way that recognises and supports the expression of Haora Māori models of care. Partnership, the principle of partnership, which requires the Crown and Māori to work in partnership in the governance, design, delivering and monitoring of health and disability services. Māori must be co-designers with the Crown of primary health systems for Māori. The principles-based approach informed the revision of the standard. These principles guided discussions, informed debate, and helped achieve consensus during the sector-wide engagement phase of this review. The 5 guiding principles were achieving Māori health equity, Te Tiriti partner principles, Kauangatanga, Tino Rangatira, Oretitanga, underpin the standards. Accessible health and disability services. People and whānau, regardless of culture, gender, disability, age, sexual orientation, ethnicity, economic situation or geographic location, have timely and equitable access to appropriate health and disability support services. Partners with choice and control. People in whānau using health and disability services have their rights upheld to make choices about their care and equity of health and wellbeing outcomes. This principle can be rephrased as nothing about us without us. Best practice through collaboration. Appropriate care includes understanding of the lived experience of people and whānau and shared decision making with them. standards that increase positive life outcomes. The standards reflect the interaction between people and whānau and their health, well-being and disability support needs. One of the key things the 2021 standard is asking for is greater evidence that service providers are developing, strengthening and maintaining relationships with Māori. As you can see in this slide, the review has provided more definition and criteria descriptions to assist strengthening and maintaining relationships with Māori, with auditors now able to look for measurable evidence as opposed to the previous standard's intentions. Bringing greater fidelity for statistics on Māori health will support realising the intent of the principles by being able to monitor service delivery and assist in measuring equitable health outcomes for Māori, including where any service delivery improvements are required. Providers are required to apply to Health Cert for certification and be audited against the Health and Disability Services Standard. These audits are conducted by an auditing agency designated under the Act, referred to as Designated Auditing Agencies or DAAs. Audits assess the provider's compliance with the standards to ensure residents are provided with safe and appropriate care. These audits are submitted to Health Cert for review to make a determination of the certification period for the provider and any other conditions they will be subject to. A certification period ranges from 1 to 5 years. In addition to the main certification audit, providers must also undergo a surveillance audit, which occurs in the middle of the certification process. Surveillance audits are against a core set of high impact standards, as well as reassessing any shortfalls from the previous audit. The Designated Auditing Agency Handbook prescribes the Health Cert Certification Audit Framework. There are 4 types of audits. Certification, an audit against all criteria within the standard. This audit determines the certification period of 1 to 5 years. Surveillance, a midpoint audit against a subset of criteria. These differ slightly by service type. Aged residential care and residential mental health and addiction services are unannounced audits and completed 3 months either side of the certification period's midpoint date. Providers funded by the Ministry's Disability Support Services use developmental evaluations in lieu of our surveillance audit template. All other service providers are unannounced audits and completed by a midpoint date. Partial provisional audits are audits against a subset of the standards focused on a new environment. They are undertaken when a certified provider either builds an extension, adds rooms in an established facility, adds a certified service type. For example, a provider is certified for rest home services and wants to add hospital services, or if there is an uncertified provider that has built a new facility. A provisional audit is an audit against all criteria that occurs when a certified provider is selling. These audits result in a 1-year period of certification. The surveillance audit criteria for Ngā Paerewa includes the majority of the 2008 standard surveillance criteria. Tiriti-related requirements have been included in the Ngā Paerewa surveillance audit criteria to ensure cultural safety is maintained. This will also support service providers to plan for and implement these new requirements. Surveillance audit criteria applies to service types in accordance with Ngā Paerewa's criteria application framework. So what does this mean for service providers? Your decision-making should continue to be underpinned by the auditing principles. Continue to use your judgment to determine the intention of the criteria is being followed. The criteria is outlined in the Public and Private Overnight Hospital Inpatient Summary of NZS 8134/2021, aligned with the sector guidance in support of the standards. We are taking a non-punitive approach to transitioning to the Ngā Paerewa requirements. The proposed implementation transition plan's non-punitive approach includes the following. Mapped criteria will continue to be audited as usual and attainment aligned with current audit practice. A short grace period will be implemented for partially mapped criteria. the provider will be required to evidence what actions they are taking or plan to take to implement these criteria. This grace period will be applicable for 6 to 12 months. Where there is no evidence of planning or progression at audit, the provider will receive a partially attained attainment with a relevant risk rating assigned, including a time frame for mitigation. A longer grace period will be implemented for criteria that is unmapped or new. This grace period may be 12 to 18 months. The provider will be required to evidence a documented action plan and implementation strategies to meet the criteria. Where there is no evidence of planning or progression or audit, the provider will receive a partial attainment with a relevant risk rating assigned, including a time frame for mitigation. So, mapped criteria are explicit or as intended in the previous standard and continue to be audited as usual and attainment aligned with current audit practice. Partially mapped new criteria are not explicit in the previous standard and/or have a new component added in Ngā Paerewa. A short grace period will be implemented for partially mapped criteria. The provider will be required to evidence what actions they are taking or plan to take to implement these criteria. This grace period will be applicable for 6 to 12 months. Where there is no evidence of planning or progression or audit, the provider will receive a partially attained attainment with a relevant risk rating assigned, including a time frame for mitigation. Unmapped new criteria are new and cannot be mapped to current requirements. A longer grace period will be implemented for criteria that is unmapped or new. This grace period may be 12 to 18 months. The provider will be required to evidence documented action plans and implementation strategies to meet criteria. Where there is no evidence of planning or progression or audit, the provider will receive a partial attainment with a relevant risk rating assigned, including a time frame for mitigation. Official mapping analysis compares previous standards with the 2021 standard, showing which criteria have changed and which have stayed the same. Mapping the previous criteria to the 2021 standard for public and private overnight hospital inpatient services shows that 72% of the criteria directly map, 11% partially map, and 17% do not map. To support providers to plan and prepare for updated audit requirements, the Standards Criteria Application Framework gives a sector-specific overview. Please take a moment to open the documents listed on this slide to review during the subsection, partially new, and new criteria summary. Criteria between the existing and updated standards fit into 3 different categories. Mapped, the 2021 criteria directly map to criteria in one of the 4 standards. The criteria are either the same or have the same intent. The wording may differ slightly. Partially mapped, the 2021 criteria partially align to criteria in one of the 4 standards. The 2021 criteria are either similar to current criteria or are the same as most of the current criteria, but with an additional element. The wording is likely to differ because the 2021 criteria reflect current accepted best practice. Not mapped. Not mapped means the 2021 criteria do not map to criteria in any of the 4 standards. The criteria are new to the 2021 standard and have been added to assure safe services to New Zealanders that reflect updated models of care. For public and private overnight hospital inpatient services, only 8 subsections and 47 criteria are applicable out of the 10 subsections and 56 criteria. Of the 47 criteria that are applicable in Section 1, 3 of the 47 criteria are partially new and 7 of the 47 criteria are new. Of Section 2's 5 subsections and 43 criteria, all subsections and 40 of the 43 criteria are applicable. 5 of the 40 criteria are partially new and 8 of the 40 criteria are new. For Section 3, please refer to the standard to see which of the criteria and subsections apply to either public or private hospitals. 7 of the 8 subsections in Section 3 are applicable. Of the applicable criteria, 9 are partially new. Of the applicable criteria, 8 are new. Of Section 4, both subsections and all the criteria are applicable. Only 1 of the 15 criteria are new. Of the 5 subsections and 30 criteria in Section 5, all subsections and criteria are applicable. 3 of the 30 criteria are partially new, and 3 of the 30 criteria are new. Please refer to the standard for Section 6 to determine which of the subsections and criteria are applicable to either public or private hospitals. Of the applicable criteria, only 2 are partially new and 5 are new. In summary, we are all learning the refreshed requirements of Ngā Paerewa Health and Disability Services Standard together. Evidence is required that service providers are forming relationships or connecting with the local mana whenua of their region. HealthCert, the Ministry of Health, are committed to a non-punitive approach to transitioning to the new standard. There will be grace periods for partially mapped and unmapped new criteria. This slide contains a summary of the references used in this presentation. So where to from here? Ngā Paerewa has been designed with the sector for the sector, and the sector is strongly encouraged to provide feedback. There will be a monitoring and evaluation phase that will run until May 2024, and we see training and development as part of the continuous improvement cycle during the monitoring and evaluation phase. To support this, resources are being developed for the learning journey for the sector and by the Ministry. The standards have been designed to be responsive to the sector's needs. For further information on resources or any questions about this presentation or the standards, please contact the HealthCert team via the certification@health.govt.nz email. Thank you for watching this presentation. Ngā mihi nui. In closing, please join us for the Manatū Haora Ministry of Health karakia. Whaia, whaia, whaia. Ngā uratanga o te Manatū Haora. Ko te manaakitanga, ko te kaitiakitanga, ko te whakapono, ko te kokiri ngā tahi, kia taatu tātou, ki pai tata, ki pai tawhiri, ki pai ora. Kia tuturu, ka whakamoa, kia tina, tina. Haumae, huie, tākie.